And finally, it is my distinct pleasure to introduce Dr. Michael Friedman. Dr. Friedman is the medical director at Chicago ENT and is the chairman of otolaryngology, head and neck surgery at Advocate Illinois Masonic Medical Center. Dr. Friedman is an internationally known expert in the treatment of sleep disorders. Physicians all over the world are familiar with Dr. Friedman as he created the Friedman staging system, which is a clinical method for selecting patients with obstructive sleep apnea who are likely to benefit from surgical procedures. Dr. Friedman was involved in the original research back in 1995 with hypoglossal nerve stimulation therapy, which is Inspire. He has authored literally hundreds of papers and 2 textbooks on the topic of sleep apnea. He served in leadership positions with prestigious organizations such as American Academy of Sleep Medicine, American Academy of Otolaryngology, Head and Neck Surgery, and the American College of Surgeons, to name a few. He lectures all over the world and has been recognized by Castle Conley and Chicago Magazine year after year as a top doctor and top surgeon, once again in 2022, in addition to many, many other awards. To say that he is an expert would be an understatement. Dr. Friedman is a true pioneer in this field, and we are honored to have him with us this evening. Before we begin, I'm going to turn it over to Steve real quick to go over some housekeeping items.
Thank you, Audrey. So this talk is being recorded, so don't share specific details or ask questions that seek a diagnosis or treatment. Rather, just the question should be about indications, risks, and benefits on the Inspire therapy. It does not replace medical care, it just provides information. And this platform is not HIPAA compliant, so your questions will not be private. When you do want to ask a question, you'll just hover your mouse over the lower half of your screen where the bar should say a Q&A button, and then just click the Q&A button and type your question, and the moderators will then be sent your question. Thanks.
Thank you, Steve. And if we don't answer the questions right away, we'll try and get to them at the end, and there'll be some time for questions. So thank you for being here, and thank you, Jay, for volunteering your time and caring so much about the community of patients who do have sleep apnea and do need help. And thank you, Audrey, for not only the introduction, but for arranging everything and your expert computer skills that have our whole presentation working perfectly. So I'm going to talk a little bit about sleep apnea and Inspire. And I know I'm talking to an audience who probably knows a lot already. I think everybody that's listening, I'm sure, has a good understanding of what sleep apnea is and what the options are. But I want to just go over some simple ideas that are the basis for treating with hypoglossal nerve stimulation therapy. So what happens when we breathe? Well, when we're awake and we breathe, air goes through our nose, and then behind the palate, this is the palate, and then behind the tongue. Now, most of us think about the tongue as being something in the front of the mouth that we protrude, which is not so bulky, but what we don't realize is that the bulk of the tongue is what's called the base of the tongue. And the tongue is really quite a big structure. Only the front of the tongue protrudes, and the rest of the tongue kind of sits in the back of the throat. And so air will go through the nose, behind the palate, behind the tongue. And when we're awake, we're not snoring, we're not obstructing our breathing. We're breathing quietly in most cases. Sometimes if we have nasal obstruction, we'll breathe through our mouth, but we're basically obligate nasal breathers, and breathing through our mouth is, one, uncomfortable, and it's unhealthy in the long term. So we want to breathe through our nose, and we want to have an open airway. So what happens when patients with sleep apnea go to sleep? Well, it's normal when we sleep for all our muscles to relax. The muscles in the tongue and the palate are relaxed, and then they fall back a little bit. Patients with sleep apnea have a narrowed space behind the tongue and the palate. So they're starting off with a reduced amount of space, and when the muscles relax and they fall back, there's obstruction, either partial obstruction or complete obstruction or intermittent obstruction. But what happens is when we breathe, we try to get airflow, there is obstruction at the level of the tongue and palate, and we're going, and then if our oxygen drops, it kind of causes what we call a mini arousal, and we'll catch our breath and we'll go, and then we'll open up the space, and then a minute later or 2 minutes later, we'll do the same thing again and obstruct again. So the problem is that the tongue and palate fall back when we're sleeping. Well, we've tried for so many years to come up with a solution for treating sleep apnea without CPAP. Well, the solution is if we can keep the tongue from falling back, well, we won't have a problem. All we have to do is keep the tongue in an awake position when the patient's sleeping, and we'll solve the problem. And that's what we've done. So let me go over some of the sequelae of sleep apnea. And just before we move on to that, the way we measure severity of sleep apnea is by looking at the number of episodes where there's no airflow going. Now, if there's no airflow at all, it's called an apnea. Now, an apnea means that the air is trying to get through and there's just no air going through at all. Now, in order for an apnea to be significant, it has to last at least 10 seconds. But we have patients that have 11-second apneas, but we have patients that have 90-second apneas, which is not so common. But the most common are apneas that last 25, 30 seconds, which is frightening for the person listening. There is also episodes that are called hypopneas. Hypopneas are only partial obstructions, which means the patient's really still breathing, but they're snoring, and that snore is causing a block in oxygen. So they're getting a block in their oxygen and a drop in oxygen. Even though they don't stop breathing, they still have what's called sleep apnea because their oxygen keeps dropping, and they can still have all these sequelae of sleep apnea, even if they don't stop breathing completely. So the only way to really assess snoring is with a sleep study. So what does it cause? Well, we know a lot of the consequences of untreated sleep apnea. Number one is snoring. Out of all the problems that patients with sleep apnea have, the number one problem that brings them into my office is snoring. Snoring is a problem for the patient who's snoring, and it's a problem for the bed partner. So patients are almost encouraged to come in, or maybe encouraged or nudged or forced to come in by the bed partner because for two reasons. Number one, the snoring is frightening. Patients who sleep with somebody who has sleep apnea are terrified because they hear this episode where they're not breathing, and they're frightened that they're not going to start breathing. So it's terrifying. So it brings the partner in. Secondly, the person listening to the snoring often is a light sleeper, and their sleep is disturbed, and they wake up tired and exhausted because they have very poor sleep. And what happens in a relationship is very often the person who has sleep apnea, who's snoring, sleeps like a log. Many patients that have sleep apnea hit the pillow, fall asleep within seconds, and then wake up in the morning and they don't know that they've been snoring. They don't know that they've had hundreds of arousals. Some of them have 30, 40, 50 episodes every hour, but they're not aware, they're asleep. But so they wake up and they feel like they've been sleeping, but they're not rested. They're not getting restorative sleep. So they're tired, they're irritable. Their response time is affected. So you have one partner that's tired, irritable, sleep deprived because they have sleep apnea, and the other one is tired, irritable, and sleep deprived because of the snoring. And it's a real problem in relationship. Many times, the partner doesn't come in until they're asked to leave the bedroom or there's an ultimatum. So snoring is a major problem. We all know fatigue is a result of sleep apnea, but many of us assume the fatigue is a result of working hard and not sleeping enough, which may be true. But even if we're sleeping less than we should, we want to have restorative, restful sleep, and sleep apnea prevents that. I mentioned response time. Now, the studies show that if somebody has moderate severe sleep apnea, they're sleep deprived and their response time is very comparable to somebody driving under the influence. So the risk of accidents and the number of accidents related to sleep apnea is very significant. We also know that sleep apnea can cause stroke, heart disease, and cardiovascular abnormalities, as well as high blood pressure. But some of the things that we don't think about is that sleep apnea causes weight gain. We know that weight gain causes sleep apnea or makes it worse, but sleep apnea causes weight gain. It's a vicious cycle. Patients that have sleep apnea are not metabolizing carbohydrates. They have insulin resistance, so they gain weight. Now, once they start gaining weight, they also have fatigue. So their exercise is diminished, their activity is diminished, they're not burning as many calories as they should. So now they're not metabolizing carbohydrates, they're not burning up calories, their weight goes up. If their weight goes up, the sleep apnea gets worse. The sleep apnea gets worse, and the cycle continues. So weight gain is not only a cause of sleep apnea, it's a result. I have patients that lose 10 pounds a month once their sleep apnea is controlled. Headaches is a common result of sleep apnea, especially morning headaches. And a lot of times people think they have migraine or other causes, but a lot of times it's from sleep apnea. It can also cause impotence. It can cause depression, irritability. If you're always tired, nothing is fun. So it goes on, and patients with sleep apnea need correction of their problem. They have choices, and many choices are appropriate. The only choice that's not appropriate is to do nothing. And many of my patients are experts on the do nothing approach by the time they come in. I see patients all the time coming in who were diagnosed 5 years ago, sometimes 10 years ago. They were diagnosed in a sleep lab and they were given CPAP and they couldn't use it. They tried different things. And then often sleep physicians and sleep labs, they have one approach. It's CPAP or nothing. So the patient comes and tells me, well, I couldn't use it, so they have no use for me, and that's it. So they're coming back 5 years later. They've had no treatment. Their weight has gone up. They're doing poorly at work. They're doing poorly in their social relationships. Their blood pressure is out of control. And nowhere during that period of time did someone tell them that there are options. CPAP is a great option, but it's just not for everybody. So I think you all know what CPAP is. CPAP is essentially an air stent. We have to have an airtight seal, and then the machine pushes air under pressure, and that air stent keeps the tongue from falling back. And again, when it works, it's great. So there are patients that love it, and patients get used to it, and patients can accept it. And I want every patient to try CPAP before they move on to anything more invasive, because CPAP is a zero risk approach. But no matter how hard they try, some patients are not going to use CPAP. Some patients cannot tolerate something on their face. Some patients have claustrophobia. Some patients their personality is just not going to allow them to be wearing a mask and a hose and attached. Some patients travel often, and they just find CPAP terribly inconvenient. We have some young patients that just don't want to have CPAP as part of their life. There's reasons, many reasons that people cannot or will not use CPAP. And all of them are valid because you're the patient. So you have to make that decision. What I think is important is that you try CPAP and that you make the decision based on some your own experience and your own trial with CPAP. So what are the other options? Well, we use oral appliances a lot. Oral appliances or oral appliance therapy is designed for patients with very mild sleep apnea or snoring without sleep apnea. So for patients who are snoring or patients who just have very mild sleep apnea, a custom designed retainer that brings the jaw forward a tiny bit is highly effective. We have an amazing sleep dental department. Dr. John Kelly works with our patients, and he's done thousands of custom designed appliances for patients with very mild disease that will correct their problem. And it's great, again, for patients with snoring or with very mild disease. It's not designed for patients with severe disease or moderate severe. What about surgery? Well, for many years, we had nothing to offer patients who could not tolerate CPAP except surgery. And surgery is better than nothing. So patients that were doing nothing, we offer them surgery. Now, surgery included taking out tonsils, reducing the size of the palate, reducing the tongue. We did robotic surgery to reduce the bulk of the tongue. So we help patients, but it was less than ideal. We want to avoid surgery. We want to avoid anything that changes the anatomy. We want to be able to correct the problem without surgery on the throat or the pharynx, and that's where Inspire comes in. Now, as I mentioned before, Inspire doesn't change the throat in any way. It doesn't cut out tonsils. It doesn't cut out the palate. It doesn't cut out any part of the tongue. It just keeps the tongue awake when the patient's asleep by inserting a small little electrode, a little chip that goes on the nerve, and then we hide a small battery that powers the whole system. So let me just show you this video that kind of simplifies the concept but shows you what's involved.
This is Mike. Mike has moderate to severe obstructive sleep apnea. After years of struggling with CPAP and constantly being tired, Mike felt hopeless. Then Mike found out about Inspire. Inspire is the only FDA-approved obstructive sleep apnea treatment that treats the root cause of sleep apnea with just the click of a button. Inspire is a small device that keeps your airway open using a gentle pulse.
It's implanted in the body with 2 or 3 small incisions in a same-day outpatient procedure.
After the procedure, Mike works with his doctor to fine-tune his Inspire. Once it's fine-tuned, Mike simply clicks the remote to turn on Inspire and goes down to sleep. While Mike is asleep, Inspire monitors his breathing. Every time he takes a breath, a gentle pulse moves the tongue out of the way and keeps Mike breathing freely. And more importantly, sleeping soundly, the way he used to. This has been a total game changer for Mike. Mike is getting more out of life and back to being his old self again. This is Mike.
I'll show you one more video that explains it a little bit more detail.
In our morning rounds, a treatment offering hope for millions of sleep apnea patients. The disorder causes people to stop breathing when they're asleep. An estimated 22 million Americans suffer from sleep apnea. It puts them at greater risk for diabetes, heart disease, stroke, and memory loss. Patients who are older, overweight, and male are generally most at risk. David Begnaud shows us the new option helping some patients. David, good morning.
Nora, good morning. For those who struggle with sleep apnea, treatments like the CPAP machine can be hard to sleep with. They don't always work, and a lot of people just can't get a full night's sleep with it. But now there's a new FDA-approved device called Inspire, and it's gaining popularity. For some people, it's a last resort. Their life literally depends on it. The Cleveland Clinic named this kind of treatment #2 on its list of top medical innovations for 2018. We met a woman who finally found relief after more than 2 decades of trying to get a good night's rest.
I wasn't breathing. I wasn't getting the correct amount of oxygen. My thought process had gone.
Good job!
Peggy Saravo's memory got so bad, her family thought she had dementia. The 59-year-old was so exhausted, she says she could barely do her job as a nurse.
So people were noticing it, but you were too.
I was too.
You knew something wasn't right.
I knew, not as quickly as they did, but I knew I was in trouble.
Peggy has severe obstructive sleep apnea, where her throat muscles relax, blocking her airway and disrupting her sleep. On average, she stops breathing 53 times an hour. That's nearly once every minute during a night's sleep.
Give me an example of a night.
Up 4 hours, maybe sleep 2. This is the area where I would sleep.
Oxygen machine,
Correct.
CPAP.
Correct.
She tried other
Close it.
treatments.
Take the mask, bring it over my face like this.
She did not find relief from the CPAP machine, a common treatment that delivers constant pressurized air.
The CPAP wasn't getting the job done, so you needed
Exactly.
oxygen on top of that.
Exactly. And then that didn't work. That's when they introduced me to Inspire and saved my life.
Inspire is a pacemaker-like device implanted in the chest. It senses when your breathing slows down and sends an electric pulse to the tongue to stimulate it forward, keeping the airway open.
This has been revolutionary. It's been a game changer.
Dr. Maurits Boone is Peggy's doctor at Thomas Jefferson Memorial Hospital in Philadelphia.
She'd given up. She had memory issues. She was miserable. This is not a benign disease. As I said, this is a killer, and it actually shortens people's lives.
I didn't realize I had it so bad.
A few months after having the Inspire device implanted,
You just need to relax and breathe normally.
Peggy went to a sleep lab to see how it was working.
Right, so listen for me on the intercom, okay? Okay, great. Good night.
They ran tests throughout the night, and early the next morning, Dr. Boone revealed the results.
So before we activated the device, we have all sorts of problems. This is basically your brain saying, I'm not breathing, I need to do something about it. And after we activate the device, it's perfect. Look at your oxygen. Nice, stable, flat line, staying around 96, 97%. So this is as good as it gets.
Okay.
And as far as I'm concerned, this is a cure. This is awesome.
A study in the New England Journal of Medicine found that more than 2/3 of patients experience less sleep apnea after getting the implant.
It was like sleeping with a herd of elephants.
For years, all Peggy and her husband David wanted was a good night's rest. And now they're finally getting it.
I'm going to show you.
Every night, Peggy turns on the implant right before going to sleep.
What's it like to sleep now?
Great. Turn myself on. Go to sleep. And I sleep. And then I get up and I turn myself off. And I have a normal day like you and everybody else.
Come here, Max. Come here, Doodles.
It doesn't work for everybody, but man, it worked for you.
It sure did. It saved my life.
The ball.
Now, Inspire is not for everyone. It's only for moderate to severe cases like Peggy, and like any surgery, there is a risk of infection. For Peggy, she says her memory is back to 100%, and she's sleeping great at night.
And is insurance covering?
So insurance, it's a case-by-case basis. Her doctor had to kind of nudge the insurance company along, but they do.
Well, she must really love her husband after saying on national TV, it sounds like a herd of elephants.
They're sleeping together
Yeah,
again.
that is really great news.
So does she
Good
have
for
to
your
wear the
marriage, too.
mask when she's got the implant?
No, not anymore. Not anymore.
Wow.
And when she turns it on, she feels nothing. She can just feel it pulsating her tongue forward.
It's like a life-saving device.
Oh, it is.
Yeah.
Absolutely.
That's great.
Let me go just through the mechanics of how this gets implanted and what's involved. So the procedure is done as an outpatient. I think one of the things that I mentioned is that it's not for mild, it's for moderate or severe. And there are certain limitations in terms of weight. Insurance companies are very particular about approving this procedure if there's severe obesity. So moderate obesity is considered acceptable, and insurance nowadays almost universally will cover the procedure. So in that initial report, when we first started, insurance companies were reluctant, but now it's considered the most, I guess, effective treatment for sleep apnea besides CPAP, and therefore it is universally accepted. It's very, very rare that an insurance company will deny it, but they do have certain guidelines, and those guidelines are usually based on severity of disease, and as long as it's not very mild, but also weight. So again, they'll approve patients that have moderate obesity up to a body mass index of 32, which is significant, but not severe. So sometimes that becomes a problem when patients cannot meet those guidelines. So what's involved? Now, before we perform the procedure, we do an examination called a drug-induced sleep endoscopy. We have our patients come to either a office setting where there's some anesthesia support, or the hospital, and we want to examine them while they're snoring. So we give the patient a little sedation. All we need them is to fall asleep for about 5 minutes. And then we use a camera to look at their throat. There are different patterns of collapse. There are 6 common patterns, and 5 of those patterns are perfect for Inspire. One of those patterns is not. So before we perform the procedure, we want to make sure the patient's a good candidate. And so this examination is an essential preparation for the procedure. Once you pass that test, and most people do, and then we schedule the procedure, which is done as an outpatient. Now, it's done with the patient asleep, and it involves 2 small incisions. One is right below the jaw, right underneath here, so it's usually not visible once it heals. And that's where the little electrode, a little chip, goes on the nerve that moves the tongue. Then there's a very fine wire that it gets passed beneath the skin. It goes from this electrode in the neck, and it goes down below the skin and the upper chest, between the upper part of the chest. And right below the skin and the chest, we hide a small battery that supplies the power, and we have a small sensor that coordinates the breathing with the tongue position. So the patient takes a breath, instead of the tongue falling back, the tongue stays in position and stays open. The procedure takes about an hour. Patients go home the same day, and some patients complain of some pain in the throat, some complain of some pain in the tongue, some complain of some pain in the upper shoulder, but usually it's relatively mild. Most patients are using only over-the-counter medication. We do offer some prescription medication for a day or so if they need it. And patients are not in bed. They can return to normal activities the next day. They usually take a few days off before going to work. We do ask them to protect this wire by avoiding sports for 30 days, but aside from that, they can do normal activities. Question everybody asks me is how long does the battery last, and when does it have to be replaced? Well, the battery is made to last for 11 years, and the replacement is a very simple process. So the battery is not embedded in the chest, it's just below the skin. So it's a simple process. One of the other questions that patients always ask me is, can they have an MRI when this is implanted? And the answer is yes. With the modern day implants, they are MRI safe. The other question everybody wants to know always, is it a problem at the airport? And the answer is, it's not a problem at the airport at all. Bed rest is not required, what I mentioned, and overall, it's a relatively simple, quick recovery. Now, when we implant the device, we test it. We want to make sure it's working. Once we know it's working, we turn it off, and we want to keep it off till everything is fully healed. So we wait 30 days or thereabouts, and then we have the patient come in to have it activated. So the activation is a very simple process. It's just a matter of activating the software so it works, and that the patient now has his own remote control, and he can increase or decrease the stimulation depending on what he feels or what he needs. So there's a range where the patient can control it. We can always change that range if necessary, but patients go home after 30 days, turn it on, and start sleeping. If they need a little more stimulation, they have the ability to turn it up, and they establish the settings where they can sleep comfortably and not have apnea or not have snoring. Does it work? Well, there's been hundreds of clinical studies proving that it works. In this study, we looked at the change in what's called the apnea-hypopnea index. The way we judge severity of sleep apnea is by the number of episodes of obstruction per hour. 0 is normal. Nobody should stop breathing when they're sleeping. If you have less than 5 per hour, it's not normal, it's not perfect, but we don't treat it. More than 5 is considered sleep apnea. 5 to 15 episodes per hour is considered mild sleep apnea. And a lot of those patients do really well with a oral appliance, a mandibular advancement device. Patients that have moderate or severe means they have more than 15 episodes per hour. 15 to 30 episodes is moderate, and more than 30 is severe. So those patients are candidates for Inspire. In this study, we looked at the average number of episodes, and the average was 29.3, like almost 30 episodes as an average. That means some patients had 40 and 50, and some had 20. This is before Inspire. After Inspire, the average was only 6.2. So there was a 79% reduction in the number of events per hour. What about snoring? Snoring is a major concern for many patients. And of course, snoring is only an issue when there's a bed partner. But on this group of patients, 83% had bed partners that were troubled and felt that there was troublesome, disturbing snoring occurring. And we asked them to give the snore level a score, from 0 being no snoring to 10 being most. And most of these score levels as high as 9 and 10. So 83% of the patients had significant troublesome snoring. Before and after Inspire, it was down to 10%. What about patient satisfaction? This always amazes me because no surgery is 100% effective. CPAP is not 100% effective, but overall, Inspire is 75% effective. But in spite of the fact that it's 75% effective, 94% of the patients give it positive feedback. There's 94% of patients are satisfied with the procedure and use the procedure, even if it's not totally effective. Because many of them just do not want to go back to CPAP or cannot go back. So they find that they use it, and even if it's not completely effective, it's beneficial. So overall, in the satisfaction surveys, there's 94% positive feedback. It's been published heavily on the efficacy. The New England Journal of Medicine is the most prestigious medical journal, reported significant improvement in sleep apnea in a large review of trials. And the question about insurance, I touched about before, but like I say, nowadays it's very rare to find denial by insurance company if you're a good candidate. So who's a good candidate? Moderate to severe obstructive sleep apnea. It's not made for just snoring. It's not for very mild. We do expect patients to try CPAP, and it's designed for patients who have tried it and either don't like it or for different reasons, their personality can't accept it, or they're troubled by feeling something on their face, or they're claustrophobic, or they travel, or whatever reason. You don't have to like CPAP, but we expect you to try it. Not liking it is a reason enough to look for other options. Overweight, again, we do get approval for patients who are overweight, and most of our patients are overweight, but severe morbid obesity is going to be a problem to get insurance coverage. So we do stress, of course, the importance of weight loss whenever possible. Finally, it's important to undergo this examination, which is done with some sedation, so you fall asleep. And you're only asleep for about 5-10 minutes. It's not a sleep study. It's done in the office or in the operating room where there's an anesthesiologist, but we want to make sure that you're an excellent candidate for the procedure. And as of now, this procedure is being done in adults only, although there are studies going on for pediatric patients as well. Before we answer questions, this is our previous Inspire rep. After our first 100 cases, we are now on our 200th series, going towards 200. But this was after the first 100. We were, I think, the first in this state to achieve that first goal. I'm going to ask Jay to share some of his experience and some of his thoughts on Inspire. And again, I thank you, Jay, for taking the time to share with us.
Thank you, Dr. Friedman. I watch these, I've done a few of these and I've seen some of those videos before, but I get something every time, and just learning more about sleep apnea. I originally went to Chicago ENT, not really realizing that I had sleep apnea. I just knew I was having problems staying awake all day, but I thought it was allergy related initially. And then the more I even learn about Dr. Friedman, because I always think, I had some allergy testing done, and then I went and met Dr. Friedman, and right away, I just feel like Dr. Friedman was like, I can tell you're not sleeping. So I remember answering a questionnaire that was really thorough, that just covered these things about, do you fall asleep okay? Do you stay asleep? Do you have dreams? And that's when I realized, like, oh, wow, like I don't dream at all anymore. So that was in 2018, and did a sleep study. I think I had to do 2 of them initially, and was given a CPAP machine, which I knew already that I was going to have problems with, just because I know myself. The idea that it's like sort of creating like an airtight seal in your body sort of didn't appeal to me, but I was excited to try it. Like if I do it and it works, then great. I really want to start getting good sleep. And so, and in fact, the first week, it was much better than not having it at all. But as time went on, I had problems with the mask, always leaving it like a sore on my face. Like, so there were all these things that had to happen for the CPAP to work, which was I had to have shaved that day because the mask doesn't fit as tightly, and I have to sleep on my back, not toss and turn. That's just not how I sleep. And so when it did work, though, then I knew like, this is what good sleep feels like, but it was very inconsistent. And then I tell a story, and so sometimes it just has to do about not sleeping in general. And I honestly can't remember if it was after the CPAP where I still wasn't getting great sleep, where I was driving one day and just fell asleep while driving, but I had it in my mind that, I'm a smart guy. Like, I'm just not going to fall asleep. That would be ridiculous. If something dangerous happens, I'll certainly know it. And so I just remember my partner hitting me saying, "Are you, what was it? Are you joking being so close to that truck?" And I was like, "Oh, no, not really joking. Let's switch." And then until I started to take care of this and look into Inspire and go through the process. So now, everybody talks about how much easier it is now with the insurance. At the time I did it, it did take some discussions with the insurance company, and Inspire helped me through that. And so in addition to Inspire, I also got something through Chicago ENT and from Dr. Friedman called balloon sinuplasty, which was also, I always like to say it was literally, I lived right next to Chicago ENT. So 45 minutes out the door, came back, was able to breathe better. And that helped actually with the CPAP, because I was able to finally close my mouth and try to see if that helped, just not moving. But eventually the CPAP, I realized it wasn't for me, went forward with Inspire. And the surgery was done at Illinois Masonic by Dr. Friedman. And it was nice because everything was explained to me ahead of time, like any complications that there could be. But I was really excited about it. In addition to just being so eager to get consistent good sleep, I always realize when there's surgery involved, family members, they all want their say is, to sort of challenge if, this is surgery, but I knew it was right for me. And so I went ahead with the surgery. As I like to say, it went very smoothly for me. I was asleep. And then the next day, at the time, it was a 3-incision surgery. And so my arm was in a sling. But the next day, I think I took pain medication the day of the surgery. Then the next morning, like half of one, and then went and walked around the neighborhood, just not really in pain, just, like I had had a procedure, but nothing really that significant. At the time, because of the 3 incisions, the other incision that isn't done now was harder for me to heal. But I've talked to other Inspire patients, and it's just different for different people. A lot of people are concerned with the scar here. On me personally, it healed so quickly that it was comical. Like, I just thought, I can't believe I just had this thing implanted and I can't even see where, where the scar is. It was really quick healing. And then a lot of people want to know, I was sort of worried, and I talked to another ambassador about the scar here, just hoping that it wouldn't cause any problems with shaving, and it doesn't. And then I had some numbness under my chin for a while, and I mentioned it to a friend. He's like, "Oh, I've had that since, I fell off a bike when I was a kid." And then I would do these talks and I'd go, "So I still have numbness here." And then one day I just went, "Oh," and and then I thought, "Oh," and actually during one of these talks, I thought, "Oh, it's not numb anymore. It just took a little longer to heal." And now everything's fine. So really what it comes down to is that it works for me and I feel great. Today is one of those days where I was sitting here thinking, if this would have been 5 years ago, or I can't do the math, but if this would have been before I was treated, I would think, oh, I have to do this thing at 6 p.m. I'm so exhausted. I didn't sleep last night. I have to take a nap. And then I would fear that I would have to take a nap and miss this talk, and I just don't have it anymore. It's like consistently 7 to 8 hours of really good sleep. I turn it on at night. Sometimes I have to get up in the middle of the night. I just pause it. I fall right back asleep. And it's become part of the process. Like when I turn it on, it's just like, okay, it's time to sleep. Where with the CPAP, I was like, oh, you got to wrestle the thing. And then I would wake up with the hose around me some nights. So it's a lot more simple. Turn it on, turn it off in the morning. A lot of people want to know what happens when you don't turn it off. And it's happened to, as far as I know, everyone who has Inspire has a story where they forgot to turn it off in the morning and tried to say hello or good morning to somebody. And because it switches to a mode where it is moving your tongue, it becomes funny because you're trying to say hello. So you have to run back and turn it off. And then what it also comes down to is with the CPAP, I had so many times where if I tossed and turned, I just felt it. There's air blowing in my face. The mask wasn't on right. I feel the hose. And so with Inspire, while I'm asleep, I don't feel a thing. I do not. It's just so, I can't think of the right word. I don't want to say silent, but it's just so like invisible as far as feeling anything. I only know that it works because I wake up feeling great. I get through my whole day feeling great. I don't have to turn down things. I don't have to turn down work. I started, so when I actually first got it, I started dreaming again. And I thought, oh, that's really how I know it's working, because I'm just getting into like a really deep sleep. So I appreciate everybody listening. If you have questions for me, I'll be happy to answer them from my point of view. If you have medical questions, Dr. Friedman can answer those. And that's about it. I hope I covered everything.
Thank you, Jay.
You are welcome.
Thank you, Jay. Thank you, Dr. Friedman. That was great. Very, very informative. I see some questions coming through. If you have a question and haven't sent that, please do that now. And we are going to take some questions from the audience. I guess the first one will be for Jay. Jay, do you feel the tongue being moved when you are in bed and awake and the device is turned on?
So initially, yes. So the remote, which I have here, has the back comes off and there's a switch for sound or not sound. I turn the sound off. And so, because my partner hears the beep and has something to say. And so when you turn it on, you feel a pulse to let you know that it is on and working. And then after that, if mine is set for 20 minutes, if I fall asleep within 20 minutes, I don't feel anything, but you can feel it, just that initial pulse. And then it's designed to work with your breathing pattern, but when you wake up, it defaults to a standard pattern. So when you first wake up and you're thinking like, oh, it's 6:30, I guess I'll get up. You can feel it until you turn it off.
And then what does the pulsing on the tongue feel like? Can you explain that?
I can. The best way I can describe it is if you've ever had like a muscle spasm, like the kind where you're like, hey, look at this, look what my arm is doing. It's like that, but very mild and very controlled. So it's also stimulating a nerve that doesn't ever have outside stimulation. So it's hard to explain in that way, but it's nothing shocking or like surprising. It just is a controlled movement of that nerve.
And then another one for Jay. How easy is it to talk when the device is turned on?
It is not easy at all. I once had to go move my car. I live in the city and it was a street cleaning day and I ran downstairs and I forgot that I didn't really notice that it was on. I moved my car to the other side of the street and then a neighbor came up and said hello. And then I tried to say hello. And because it's in a default pattern, of moving your tongue out of the way, I couldn't say hello. And I actually had to text like, like I'm not coming home after a late night. I really just, then I think I explained and maybe sent the video from one of these talks. And then so the result of that is always somebody goes, oh, my uncle should look into that. I know somebody who really could benefit from that. So that's all. The other thing is I've left it on also and forgot to pause it when I've gone to get a drink of water in the middle of the night. And that requires also turning it off into pause mode. But it's nothing like so outrageous that, I mean, what it all comes down to, I would never, any of those things are such a minor trade-off just because of the terrific sleep I get now.
All right, thank you. Dr. Friedman, we have one for you. If for some reason the device had to come out, how complicated would that be?
So of course, whatever goes in can come out. But I must say that it's not something that happens very often. Because even like in patients, and it's not 100% effective, but even in patients where it's not completely effective, the patients want it and they use it. And I showed that slide that showed 94% satisfaction. That means 6% of patients don't like it or don't use it. But in those cases, we just leave it because it's not hurting anything. It's inert. It just sits there. And like I say, you can have an MRI, you go to the airport. So could we take it out? We could, but it's very rare. Now, there's a risk of infection. And if there's an infection, it would have to be taken out. But that is less than 1%. So it's extremely rare. So the answer is, it is harder to take it out than to put it in, and it's not very common that we would take it out.
And we have another question. What if I am out of town and need an adjustment?
So adjustments are not very common. In other words, Jay might be able to answer it better than I do, but for most patients, they can self-adjust. They have a range where they can turn it up or turn it down. So they can self-adjust. In rare situations, we have to do some software changes, which is pretty rare. Now, theoretically, there are now, when we started doing Aspire, it was limited to certainly not every state or every city, but now Steve might be able to answer more than I would. But every major medical center now has experts in Aspire, so it's not something that is a major problem. It reminds me of patients with CPAP. Now, patients with CPAP travel, and if they forget their CPAP, lose their CPAP, so then for many of them, it's a real crisis because we have to get them a CPAP. Many people, once they're used to good sleep, don't want to spend even one night without it. I guess theoretically, you could also lose your remote, in which case we'd have to find a way to replace it. But I think the simplest way nowadays would probably be FedEx or a quick delivery system.
Great. All right, and I think the final question will be, will the device be visible beneath my skin?
So maybe Jay can answer better than I can. I would say for the vast majority of patients, it's not visible. I think if somebody is very thin-skinned and very skinny, it's possible, but for the vast majority of patients, it's not visible.
Yeah, I agree. I don't ever notice mine unless it's usually when I do one of these talks and I sort of do this, but I never ever notice it physically when I look in the mirror.
All right, great. I think those are all the all the time that we have for today with the questions. If you have sent a question and haven't answered, we will make sure to email you an answer. If you would like to learn more about Dr. Friedman, you can go to our website, chicagoent.com, and you can also read about his recent accomplishments in our blog titled Dr. Friedman, a True Leader in Sleep Medicine. And finally, if you'd like to schedule a consultation with Dr. Friedman, you can book an appointment 24/7 on our website at chicagoent.com, or you can call our office at 773-296-5500. You can come see us at our Skokie or Lincoln Park locations. You can also follow us on social media channels for the latest updates and information about Chicago ENT. You can go to our YouTube channel and watch Dr. Friedman and Jay being featured on the American Health Front television show program discussing the benefits of Inspire. On behalf of Chicago ENT and Inspire, we would like to thank you. We are very appreciative of your time, and we cannot wait to see you in person to take care of all your sleep apnea needs. Thank you and have a great evening.
Thank you, Audrey. Thank you, Jay. Thank you, Steve. Thank you, everybody, for listening. Have a great night.
Good night.